Hello, my name is Derek Mahoney. I'm an orthodontist from Sydney, Australia, and I'm here to chat to you a little bit about the new program that we're offering. This program is geared towards the general practitioner to improve their skills in fixed appliance therapy. There's an emphasis in this program on lighter forces, what is termed as passive self-ligation. It's a three-part program. The first part of the program will discuss case selection and bracket positioning. We then move on to archwire selection and complete the series with case finishing. We feature the Daemon System in the majority of our lectures. My background in fixed appliance therapy started as my undergraduate training with the BEG appliance, and the BEG appliance uses light forces but is quite difficult to case finish. From BEG mechanics I moved on to standard edgewise and then to pre-adjusted edgewise known as straight wire. The advent in the newer systems of braces is a passive self-ligation so that the forces are reduced, and this allows the general practitioner to treat many more adults on a non-extraction basis. We divide the program into three modules. The first module discusses the philosophy of the Daemon System, where we use the face to analyse our treatment mechanics, and the motto that we use is you do not extract for space, but rather you extract for the face. What that means is in cases that are very protrusive, lip incompetent, high angle, we'll discuss extraction mechanics, but for the majority of cases where the facial profile is flat or ideal, we would try and treat the case on a non-extraction basis. In the past, we would wait until our final wires to use elastics to correct our skeletal problems such as class 2 and class 3, and our vertical problems such as deep bites and open bites. With the newer philosophy in the Daemon System, we start with early light elastics from day one. We use disarticulation to help our mechanics, and we use variable torque. The use of variable torque minimises the need for case finishing. For instance, in a class 2 case where we are using elastics, we know that the upper incisors will retrocline and the lower incisors will tend to procline. So to compensate for that, we will use a high torque bracket in the upper and a low torque bracket in the lower. Conversely, in a class 3 case where our mechanics are to dentally compensate the class 3 problem, we will use the opposite. Low torque brackets in the upper arch and high torque brackets in the lower.